Hey guys, welcome back to my channel. Today I'll be talking about diaphragm. The thoracic outlet is closed by the dome-shaped muscle called the diaphragm. Diaphragm is also called large muscular aponeurotic structure that is attached to the margins of the thoracic outlet and separates the thoracic region from the abdominal cavity. Hence, it is also called thoraco-abdominal diaphragm. It is dome-shaped and principal muscle of respiration. When you look at the structure, you could find peripheral muscular part and central fibrous part called the central tendon of diaphragm. The central fibrous part of the diaphragm is called central tendon of diaphragm. So as if we see this here, this diagram, you could find two dome-like structure, the right dome and the left dome. This right dome reaches the level of a fourth intercostal space, and the left dome, it is present at the lower border of the fifth rib, and the central tendon of diaphragm is present at the sixth costal cartilage region. These are the locations. Now coming to the how this diaphragm is originated. It is originated by three parts. One is the sternal part, costal part, and vertebral part. Firstly, the sternal part. It is arised by two fleshy slips arised from the posterior part of the xiphoid process. From the posterior part of the xiphoid process, it has originated as two fleshy slips, and from the costal parts, it has arised by six fleshy slips from the lower six ribs near the costal cartilage, and the vertebral part has arisen by the right and left kura of the diagram and five arcuate ligaments. I'll tell you what is this kura and arcuate ligament, and all these are the origins and how do they converge and where do they converge. All these muscle fibers which have arisen, they converge towards the central tendon. Next, now I said I'll be talking about the crura. So crura is a plural one and crus is a singular word. Crus is actually the anatomical elongation that arises in the form of a pair. Crus, the right crus, is a vertical fleshy bundle that arises from the right side of the anterior part of the upper three lumbar vertebra, including their intervertebral discs, and left crus is a vertical fleshy band that arises from the left side anterior part of the upper two lumbar vertebra, including its intervertebral discs, and this medial margins of this crura, they are tendinous, and these are the crura or nothing but the cross. Now coming to the arcuate ligaments, which are five in number. The first one is median arcuate ligament, a fibrous arch that extend between the upper ends of two crus of diaphragm, and medial arcuate ligament, it is a thickened upper margin of the psoas sheath, the facial sheath, the fascia covering the psoas major muscle, its upper part, the thickened upper margin of this psoas sheath, it extends from the side of the L2 vertebra to the tip of the transverse process of a L1 vertebra. Lateral arcuate ligament, it is a thickened upper margin of the fascia covering the quadratus lumborum. It extends from the tip of the transverse process of L1 vertebra to the 12th rib. These are the crus and the arcuate ligaments. Now let us talk about the central tendon. The central tendon is a foliate shape having a single anterior central triangular shape. This is the anterior central triangular shape, and two tongue-like posterior structures. So this is the right leaflet, which is short and stout, and this is the left leaflet that is thin and long, and it is inseparably fused with the fibrous pericardium of the heart. It is present close to the sternum than to the vertebral column. Surfaces and relations. Superior surface, on the either side, it is projected like this as a dome or cupola into the thoracic cavity and leaves a central depression called the central tendon, and this superior surface is covered by the endothoracic fascia. This also covers the base of the right and left pleura on the either sides, and pericardium in the central part. And the inferior surface, it is lined by the abdomen. It is covered by the diaphragmatic fascia and the parietal peritoneum. The right side, now coming to the relations of the right dome. To the right dome, the structures present over there are right lobe of the liver, right kidney, right suprarenal gland, left lobe of liver, left kidney, fundus of the stomach, spleen, and left suprarenal gland. Left suprarenal gland. If you see this right dome is more concave than the left dome. This is due to the presence of the liver. Due to the presence of the liver. Now coming to the nerve supply to this diaphragm. It is done by two types of nerves, right and left phrenic nerve and lower 5 intercostal nerves and subcostal nerves. Right and left phrenic nerve, they are both motor and sensory. This right phrenic nerve provides the motor supply to the right dome of the diaphragm till the right end of the esophageal opening, and left phrenic nerve, it provides the motor supply to the left dome up to the left end of the esophageal opening. And these phrenic nerves, they provide sensory innervation to the central tendon, pleura, and pericardium. And this lower 5 intercostal nerves and subcostal nerve, they supply the peripheral parts of the diaphragm. See, these are the peripheral parts supplied by the intercostal subcostal nerve. This till right end this till right end of the esophageal opening is supplied by the right phrenic nerve. Till left end is supplied by the left phrenic nerve. Now coming to the arterial supply. Superior inferior phrenic artery, pericardiophrenik artery, musculophrenic artery, superior epigastric artery, lower 5 intercostal arteries and subcostal arteries. The superior phrenic artery is a branch of thoracic artery, inferior phrenic artery is a branch of abdominal aorta. Remaining all of them, they are branches of internal thoracic artery. Now coming to the lymphatic drainage. Anterior diaphragmatic lymph node, it is present behind the xiphoid process, and posterior diaphragmatic lymph node, it is present near the aortic orifice. Right lateral diaphragmatic lymph node, it is present close to the vena cava opening, and left lateral diaphragmatic lymph node, it is present close to the esophageal opening. Actions of this diaphragm, it acts as a muscle of respiration. So when diaphragm contracts, it is pulled down and vertical diameter is increased, that causes inspiration. The muscles of the abdominal straining, contraction of diaphragm, it causes anterior abdominal wall to contract and increases the intra-abdominal pressure that lead to the evacuation of the pelvic contents like defecation and urination. Next, the muscle of weightlifting and thoracomuscular pump, relaxation of diaphragm, it decreases the intrathoracic pressure and also increases and decreases the intrathoracic pressure. This pressure of increasing and decreasing, it compresses the inferior vena cava, which forces the blood into the right atrium and act as a sphincter of esophagus. We know this esophageal opening, it is formed by a slit formed by the right crust. The fibers of the right crust, they act as a sphincteric control over the esophageal opening and prevent the regurgitation of the food. Okay guys, thank you for watching my video. If you like my video, please do share with your friends, and if you think anything is missing, please let me know in the comment section.